Hi, my name is Lisa Wiley, and today I'm going to show you how to start a primary line and a secondary line. So first, I would go ahead and I would obtain the order from the chart or the electronic MAR from the physician. I would then go to the med room. I would gather my secondary tubing, my primary tubing, my antibiotics, and I'm going to go ahead and go say hello to my patient. So go ahead, I would knock on the door. Hi, my name is Lisa. I'm going to be your nurse today. Can you please state your name and your date of birth?
Sandy Vinson, 12076.
Okay, perfect. Hi, Miss Vinson. So your doctor has ordered some fluids to be hung for some hydration. He ordered some normal saline, and he's also ordered an antibiotic for you. Do you have any allergies?
No, I have no allergies.
No allergies. Okay, perfect. I'm going to go ahead and get started. Let me go ahead and, I would go ahead and perform hand hygiene, and then I would go ahead and put my gloves on. First thing I want to do is I want to check the IV site to make sure that it is still patent and that there's no phlebitis or any infiltration or anything. So I would go ahead and I would check it, and it looks good. So I'm going to go ahead and I'm going to flush the line. I'll go ahead and take my alcohol pad first and clean the port. And then go ahead and connect my flush. Flush just a couple of cc's, and it looks good. No infiltration or anything. Ms. Vincent, does your IV site hurt at all?
No, it's fine.
No, it's fine? Okay, good. So go ahead and set that aside. Next up, we're going to go ahead and get our primary tubing. Our hydration of choice is normal saline, 250 cc's is what's been ordered. So I'm going to go ahead and make sure everything's in date, which everything looks good. Okay. And first off, so I don't lose all my fluid, I'm going to go ahead and clamp off my line. And I would pop the top. Go ahead and put this together. Then go ahead and flip my bag. I'll give my chamber a squeeze to fill it up a little bit. And go ahead and hang it on the IV pole. Okay. Then go ahead and I will unclamp to go ahead and prime the line. Make sure there's no air bubbles. And everything looks good. So then I will then come over here. Alcohol the port again. And go ahead and connect my line. Okay, and once that is all connected, I will go ahead and come back over here. And depending on what the physician ordered, how fast he wants the fluids to run, I would then go ahead and program it into the pump. So if he wants 250 mLs over an hour, go ahead and prime my tubing into the pump, set my pump, then once all that would be set, I'll go ahead and unclamp it and let the fluid start. And that would be for the primary set. Now, Ms. Vincent, your doctor has also ordered an antibiotic, 1 gram of vancomycin. So I would then go and get my secondary tubing set. And make sure this is clamped off as well. Go ahead and pop the top on that one. Make sure my IV is in date. Everything is not expired. Go ahead and connect the bag. I go ahead and flip it. Fill the chamber as well. A little bit there. And then I will go ahead . Now, before I came into the patient's room, I already put the name and the date and the time of the antibiotic on the medication bag, so everything has already been labeled. Matches her armband, so we've got the right person, right drug. We're good to go. I'll go ahead, and then the secondary line, I'll go ahead and unclamp this and prime the line for that as well. Once all the air bubbles are out of that, I'll go ahead ahead and reclamp my line. Come over to my primary line. Go ahead and clean the port on my primary line. And connect my secondary line to my primary line. Now once those two are connected, I will then extend, or I guess drop down my primary fluid since I want my antibiotic to run in faster and sooner, I suppose. Go ahead and put this, drop the primary line down, and my secondary line is now higher, so then this will be down back in the pump. And once that is good, I'd go ahead and unclamp my secondary. So my antibiotic, I'd go ahead and unclamp that and start running. And then the antibiotic and the fluid will both once I have this going, I actually do need to program the pump again for the secondary drug for how fast that needs to go in. So I would program, then unclamp, and then run the antibiotic along with the primary fluids that are already running. So once that is going, I'll come back and check my patient again and make sure that there still is no infiltration, that there's no pain, and I would assess the patient and make sure that they're not having any form of reaction or anything to the medication. Ms. Vincent, do you feel okay?
Oh, I feel fine. Everything feels fine.
Okay, good. I'm going to go ahead and I'll be back in a couple of minutes to recheck and see how this antibiotic is doing. And we'll be back to check on you.